The art of implementation research, turning evidence into action. Hello, and welcome to my channel. Today, we're diving into an exciting and impactful field, implementation research. If you're a medical or health researcher who wants to bridge the gap between evidence and real-world practice, this video is for you. We'll guide you through the essentials of turning research findings into actionable interventions that can make a real difference. Ready? Let's get started. First things first, what exactly is implementation research asterisk? Simply put, it's the science of getting evidence-based interventions into real-world practice. You've probably seen studies that show a promising intervention, whether it's a new drug, a health policy, or a clinical guideline, but how often do these findings actually make their way into everyday use? That's where implementation research steps in. It helps us understand the how, why, and what of implementing evidence in practice, especially in complex and dynamic health systems. Let's talk about some key concepts that you'll come across in implementation research. Understanding these will help you design better studies and interventions. 1. Implementation strategies. These are the methods or techniques used to enhance the adoption, implementation, and sustainability of a program or intervention. For example, you could use training programs for healthcare workers, reminders for patients, or changes in organizational policy. 2. Barriers and facilitators. You need to identify what helps and what hinders the implementation of your intervention. Barriers could be anything from a lack of resources to resistance to change. Facilitators, on the other hand, are factors that support successful implementation, like strong leadership or community buy-in. 3. Outcomes in implementation research. Implementation research doesn't just look at whether an intervention works, it also measures how well it's implemented. Key outcomes include acceptability, adoption, fidelity, and sustainability. Understanding these will help you refine your intervention for maximum impact. Implementation research uses various frameworks and models to guide the process. These frameworks help you plan, execute, and evaluate your interventions more systematically. 1. The REAIM framework. This stands for Reach, Effectiveness, Adoption, Implementation, and Maintenance. It's a popular framework for evaluating the public health impact of an intervention. 2. The Consolidated Framework for Implementation Research CFIR. CFIR is comprehensive and helps identify factors that influence implementation across different settings. It's like a roadmap that guides you through the process. 3. The Theoretical Domains Framework TDF. This framework focuses on behavior change. It's particularly useful if you're dealing with human elements like healthcare provider behavior or patient adherence. These frameworks aren't just academic exercises, they're practical tools that help ensure your research has a real impact. Choose the one that best fits your project and use it as a guide throughout your study. So, how do you design an implementation research study? Let's break it down into steps. 1. Define your research question. Start with a clear question like, how can we improve the uptake of a new vaccine in a rural population? Or, what are the barriers to implementing telemedicine in primary care? 2. Select your framework. Choose an implementation framework that aligns with your research goals. 3. Identify stakeholders. Engage the people who will be impacted by your intervention, like patients, healthcare providers, or policymakers. Their input is crucial for ensuring that your intervention is relevant and feasible. 4. Plan for sustainability. Think beyond just implementing the intervention. How will it be maintained over time? Sustainability is key to long-term success. 5. Measure your outcomes. Finally, determine how you'll measure your success. Remember to focus on both implementation outcomes like adoption and fidelity and health outcomes like patient health improvements. Let's look at a few examples of successful implementation research to inspire you. 1. Hand hygiene interventions. Studies on hand hygiene practices in hospitals have shown that simple interventions, like providing hand sanitizers and educating staff, can drastically reduce infection rates. Implementation research helped identify the best strategies to make this a routine practice. 2. Maternal health in low-resource settings. Implementation research has played a huge role in improving maternal health outcomes in low-resource settings. By understanding the local barriers and facilitators, interventions such as training birth attendants and providing mobile health tools have been successfully implemented. Implementation research isn't just about generating more data, it's about making sure that the knowledge we already have is put to good use. It's about turning evidence into action to improve health outcomes for communities around the world. Whether you're a researcher, healthcare provider, or policymaker, your work in implementation research can make a real difference. So, let's work together to ensure that every piece of evidence translates into action. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss an update. Let's continue turning research into action, one intervention at a time.